I don't know what to do. I don't know what else you'd use. Sulfa. Sulfa's active. I've got the flag. Good morning. I'm Mark Dowell, and my partner, Dr. Ghazi Ghanem, and I are the county health officers for Natrona. As you can see, I'm wearing a Gumby facial covering, which, of course, I've been a long time fan of Gumby. I'm going to take this down right now so you can see my face and I can talk about this, and I won't have any trouble with you hearing me. What I thought I would do this morning is update you on what is going on in our county and give you some accurate information so we quell the rumors out there. As of today, we have 13 new cases in Natrona County since Thursday. As you know, prior to that time, we went over 2 weeks without an identifiable case. Obviously, this is very concerning. The messaging for the last 2 months within the state and within the county was that there is virus in the community in people that don't have symptoms. People ask the question, what is asymptomatic shedding? Because they don't know that term. We know what asymptomatic is. You don't have symptoms. Shedding means you have an ability to pass the virus and not know it. We are currently working with County Health, Wyoming Medical Center, and the State Health Department on a daily basis to sort all of this out, do the appropriate contact tracing, and try to see if there's a single source or multiple sources. But we have no doubt that there is community spread, which was the concern all along. You probably have heard that there are 4 nurses at Wyoming Medical Center that have tested positive. We are still working on figuring out if there's any relationship and exactly what is going on there. I want to make it very clear that this investigation is ongoing and we don't have definitive answers yet. This is all just evolving. And we will be able to update you as we put this together. But as you know, from across the country, contact tracing is difficult, a lot of times convoluted. It's like looking into a spider web. And sometimes you can trace it easily and sometimes not. Because the thing we don't have, since we don't have mass testing, is information as to who's out there with no symptoms that may be part of the issue. We have tested lately over 100 employees at Wyoming Medical Center beyond those 4 nurses, and they're all negative. Also to remind you that we are a referral center at Wyoming Medical Center, so we have patients coming in from other counties, and they potentially can also introduce it into the county. Our mission here is to serve the people in Natrona County, but also serve the entire state of Wyoming. We have now set up at Wyoming Medical Center in coordination with the state, our lab at the hospital, and the local physicians, a testing system so that patients are going to have surgery can be tested ahead of time. And that has all been set up within the last few days. We've been working on this for a couple of weeks. It's a very hard system to set up. We have also worked with our colleagues in Fremont County, which, as you know, is a hot spot, to have testing over there before they come to Natrona County to get their surgery. and that is going well. And so we will continue to track this in the hospital. Now, a question you may want to ask is, well, are you going to test every single patient that may have been exposed, if at all? You know, one of the things is we have a uniform masking policy at the hospital for physicians, all employees, and visitors. But this virus knows no boundaries, as you know, and so what we're doing is we're going to be notifying patients within that given period of time to be checking their temperatures and to look for symptoms. But to mass test all the patients doesn't make a lot of sense. And again, we have to preserve our ability to test, because this is going to go on, you know, in the community, in our opinion, all summer, on and off. And then the big concern is the fall and winter, as you've heard nationally. So rest assured that we're on this. We're going to get whatever answers we can. We're doubling down on what we're doing in the hospital in terms of emphasizing masking or face covering, if you want to be more accurate with that, hand washing, limiting visitors, as those of you that have had people in the hospital know, and going over this with employees. I did a video with Michelle Chulik yesterday, the CEO at Wyoming Medical Center, again, designed to inform the employees, emphasize what we need to do as an organization, and emphasize as well that when an employee at Wyoming Medical Center is not working, they need to do the same things that we have emphasized all along out in the community. This is not a political thing. This has to do with health and safety of not just you, but your neighbors, your friends, the people you work with. You know, when you look at this, we have worked closely with the governor's office, the state health officer, the officials in the county commissioners, city manager, mayor, and businesses to try to come up with a reasonable plan. What this shows you is that this increase in cases correlates really well with people not following our recommendations as well as they could. There's no question. This has been the worry nationally, and we're seeing this in other states. You loosen the recommendations and the compliance with what we want you to do, and you see an increase in cases. I've got to tell you, we can do a better job as a community at following the guidelines from the state and from our health department. I'm disappointed in the lack of use of face coverings when people enter businesses and are in gatherings. I'm disappointed in the lack of social distancing. It's as if people don't think it's real or don't think they should have to do it. But they can be the person with no symptoms that can spread it. And I think the families of the 90,000 Americans that have died in the last 2.5 months would appreciate it if we did what we needed to do even in Wyoming, because we're seeing increases in other counties as well. That does not mean that we have to go back and close everything down. That's not the goal. That's not the plan. But we have to remember what got us to the point where we were really doing well in Natrona County. And I feel like we as citizens have taken too much of a jump from doing pretty well with face covering and social distancing to kind of blowing it off. And that's not the message at all. Let me give you a couple of examples. A very well-known person went into a restaurant over the weekend, and as we know, our restaurants have very much said they want to comply with what the governor's recommendations are that we echo about face coverings, cleaning the tables, distancing, this kind of thing, and multiple employees were not wearing face coverings. But I went into a restaurant a few days ago, and everybody was wearing face coverings and cleaning down the tables. It's not acceptable at this point to say, oh, it's no big deal, I'm not going to follow these recommendations. I want businesses in general, I don't care if it's a hardware store or restaurant, to have your employees wearing face coverings out of respect for the community. And I expect our restaurants to do that. So we went into a gymnasium, and one of the gymnasiums, fitness centers are very, very tricky in terms of people breathing heavily, spewing their saliva while they work out. And it's a great place to transmit the virus. You feel good enough to work out, you don't realize you're still infected. So we set pretty good guidelines about that, feeling that we want to give our community a chance to start exercising. That's great. Well, we walked into one, and not a single employee had a face covering on. And one of the things we had talked about was cleaning the employees cleaning the machines. They were having patrons clean the machines. That's not acceptable. They're not going to do a good job. The majority of us, when we work out in a gym, don't even remember to clean it off, don't clean it off before we jump on the treadmill, and many people, human nature, don't clean it afterwards. So for my 2 cents, if the fitness centers want to stay open, which we want them to, for mental health if nothing else, double back on what you need to do it right, follow the governor's recommendations so we don't get into problems. Because once we see a few cases like we are now, if you follow the national data, that means there are 2 and 3 people potentially not realizing they're ill out there as a result of somebody being positive. We have to be careful right now. I emphasize to you that the governor put out these orders for a reason, and we need to follow them. I think that it is really, really important to understand that this is serious stuff. In my practice with Dr. Ganem, we had a patient that we had been following for 23 years. And she was beloved by our practice, and she died of COVID 2 days ago. And it's really disappointing and sad. We know this is going to happen, but I want to emphasize, we're not doing this to torture the community. We're doing this to keep the community healthy. I don't like wearing a mask any more than you do. But those are the national recommendations. And if we don't do things the way we need to do them, we're not going to have the summer we wanted, and it's going to set us up for potentially a real problem in the fall and winter in our schools. And all of us want our schools open in the fall and safe for our children. It's better to do it on the front end now and get used to doing things right than act like this doesn't exist. And yes, it's true, kids don't get as sick, but you've heard about some of the things that are happening to kids where they're getting severe illness. And it is true that those of you in your teens and 20s may not get ill, may not even know you have it, but you're the exact people that need to do the face coverings and social distancing so you protect your parents and you protect your grandparents. There's an outbreak in a nursing home up in Worland. That could easily happen here. And we have big nursing homes. Think about what's going to happen if we get a case or 2 in a nursing home. That's going to spread like wildfire, and the whole game's going to change. We are increasing our testing across the county. We've still got active testing going on at County Health and in the respiratory clinic through Wyoming Medical Center. And we're seeing an uptick in people coming in sick to get tested. There are a bunch of tests pending from those people. And we're hoping that that's just a summer virus, not coronavirus. But we don't know that yet. But we track that as one other way to know what's going on in the community. I want to emphasize something else that is starting to show up in the community, and that is antibody testing. What is antibody testing? If you're infected with a virus, COVID-19, for example, your immune system makes proteins to fight it. And you've heard about how we treat patients sometimes with convalescent plasma. Basically, somebody got over the infection and donated their antibodies back to someone else to try to save their lives. The problem is right now, the majority of these antibody tests are not accurate. It does not answer the question. You can have false positive tests. You can have false negative tests. And in fact, just because you have a positive antibody test, that does not mean that you cannot get the virus again. We don't know what it means yet. We will. It does not mean that you couldn't get it again and potentially not get sick and pass it on to someone else. So I urge you not to use those tests at this time, because we don't know what to do with them. They'll give you a false sense of security if the test is positive, but it does not mean you can't potentially infect someone else. When really good tests for the antibodies, the serology, come out, we will start using them because it gives us an idea of what is out in the community and what has been there for the last several months. You've heard the comment, herd immunity. Well, just let the community get sick, let 70 or 80% of the population get ill, and then we'll all be protected, even if we don't have a vaccine. You've heard those comments. Well, you only have maybe 5–8% of the entire U.S. with positive antibodies against coronavirus. Yet you have millions of people infected, and you have 90,000 Americans dead. So you can imagine if you don't do your social distancing and you don't use your face coverings, which are the two things that really keep this virus from spreading as much, and you just say, well, we're just going to allow herd immunity to occur, you're going to have, I don't know, 1 million deaths, 2 million deaths, until you have herd immunity. That's why testing and time and eventually a vaccine will really change how we manage this. The more testing we have for our community, the more information we get, the better we can manage this, the better we can contact trace. So I think that the message today is that it's time to double back as a community, follow the guidelines, take it seriously, do this for you, your family, and your friends' families, and the community in general, and let us help guide you with this. We'll get more information as we go along, and we'll adjust things as we go along. We want you to have a good summer, but a safe summer. And again, we're not doing this to be mean. We're doing this for health reasons. Thank you.
Dr. Dahl, with the disappointment you expressed about people in the community not quite following the recommendations, have there been any considerations or discussions about any new variances in the county in light of that?
So the question is, in light of you saying people aren't really following the guidance, have you considered any new variances for our county regarding that?
It's an interesting question. I'll tell you why. There are a lot of requests for variances for different businesses and activities. such as you heard about the car show. We look at all of them, but we want to make sure people understand that when you look at variances, they have to be reasonable, and when the community is not really complying with what we're trying to get you to do in terms of following the distancing and the face coverings, it makes it even harder to know what to do with the variances. We're not mean, we just have to take it on an individual basis. But when you have 13 cases since Thursday, it makes you really have to think it through. We want people to be able to do things, but we have got to do it safely.
Follow up on the flip side, have there been talks about, restricting any of the regulations that have been loosened and, I guess, going stricter in Natrona County than the current state recommendation?
So the question was, are you considering any kind of orders that would maybe have stricter requirements in our county?
No, we're not at this time planning on tightening restrictions. No, we're going to follow the lead of the governor. Things would have to be seriously exploding in the state or the county to ever consider that, and that would be done in coordination with city and county officials and, of course, with the governor's office and the state health officer. We would rather work with everybody and say, come on, guys, do what you need to do for everybody's health and work with people. We don't want to make things punitive. That's really not the goal, and that's certainly not the role of the health officers, Dr. Ganem and I. We're not involved in enforcement like that. We're trying to advise and be pointed in what you need to hear.
Dr. Bell, though we were meeting requirements, do you think we reopened too early?
The question is, do you think that we reopened too early?
No. But I thought that we would follow the guidelines more strictly as a community. I thought we kind of had an understanding, if we loosen, we're all going to do this. And there's plenty of opportunities to still do that. It's extremely difficult to latch back down on all the activities and the businesses once you've opened them up, unless you have a tremendous outbreak within your community. Yeah, I'm more just sort of disappointed that people aren't doing what they need to do, but we're going to try to work with them, and I want our businesses to step up to the plate, and those of you that are doing a great job, thank you. And those of you that are not doing what we need you to do, please think about it and jump in, because when you have 13 cases since Thursday, this is the real deal, and it's the tip of the iceberg, and we don't want to go there.
Yeah, I guess you could talk a little bit about how you guys sort of gauge community-wide behavior. Is it just sort of kind of an anecdotal thing, what you're seeing around town, or is there kind of a more scientific approach to sort of, getting a sense of how well people are or are not following the recommendations?
So how do you look at the community's response and how they're following the guidance? What does that look like?
We have, it's an informal system, basically. We're out in the community. There are a lot of us that work in healthcare, leadership at Wyoming Medical Center, employees at Wyoming Medical Center, our practice people, county health, city and county officials. We're all out there seeing this, and I have firsthand seen a lot of stuff. And we can just do it better. In terms of how we track it, we don't need to track it. It's out. We see it. We've seen it in some of the gatherings. It's everybody knows what's going on. So what we're trying to do is have people both in a business and out of a business, rethink what they're doing. And we don't want to be tough with people. We want people to do things for the right reasons. And so if we continue to see problems, then we have to, as a community, ask, why are we doing it this way? But all of us know what's going on out there. And, you know, those of you who go to a grocery store know exactly what I'm talking about. The employees are wearing their masks, but probably 20% of the patrons, and that's just not, that's not okay.
One more to clarify real quick. I think at the top you mentioned there have been 13 new cases since Thursday. I think yesterday was announced 11, so just wanted to double check that there are 2 new cases. Is that right?
Yes, there are.
So just to reiterate, 2 new cases today.
Yes. 2 new cases this morning.
I know, Dr. Dahl, you were saying about the antibody testing for people not to get, false hope. There are kind of businesses who are local medical areas who are saying that they have it. What would you say to the people who are kind of going in to get that antibody tested?
So the question is, what would you say to people who are receiving antibody tests within our community?
Hold off. Hold off until we have better tests. I mean, every business has a right to offer them or run them if they wish, but I think the community needs to understand the science behind them, and that we would not be using those kind of tests to tell us what's in the community at this time because they're not accurate enough. So I don't want people to, as I said earlier, get a false sense that gives them some reassurance and really don't know what to do with that information at this point. And so I would stay away from it. But when we have the right tests, antibody tests, we'll start using them, and we'll let the community know, and we'll work with the providers and the businesses, and it may be very helpful. But if you look at what's being done at the meatpacking plants across the country, they're not using antibody tests to decide what to do with their employees. They're using the PCR antigen tests. And that's a different test. That tells you if you're actually infected with the virus. And those are the tests we really need right now. Serology, those antibody tests, are for looking back, not looking at the present time or forward.
Seems like there's a sentiment in the community a little bit that the recent increase over the last week is a result of increased testing rather than community spread. I guess can you address that idea?
So the question is the new positives the result of community spread, or is it actually just an increase in testing?
No, we were not just doing mass testing. We're testing people that think they've been exposed, doing it as part of contact tracing, but mostly just testing people that come in and are sick. And so, no, this is not an increase in testing just because. This is testing for a reason. And that's what tells us this is community spread. And now, as I mentioned before, now that we're starting to see sicker people showing up to get tested, we'll see what that means in the community. And I'm certainly hoping that that doesn't have anything to do with COVID-19. But we won't know that for the next 24, 48 hours. We're tracking the exact numbers that come into testing sites.
Dr. Dow, kind of at the national level, we've seen that kind of people are afraid to come into the hospital because they're afraid to contract COVID. Can you talk to me about people in the community who, might be scared of that to come into the hospital because they don't that kind of
So the question is, can you talk to the people in our community who may be afraid to get care at the medical center just because they're afraid of contracting COVID-19?
Excuse me. I think that I think hospitals that are diligent in what they're doing are safe, and that really the vast majority of what's going on in hospitals is infection that is introduced into hospitals from community. Can it spread in a hospital? Sure. We know you've got COVID-19 patients in an ICU, and you can do everything. You follow every guideline, and everybody does it perfectly. And as you've seen in New York, people can still get infected. Do I feel like it's safe at the local hospitals? Yes. Would I get hospitalized there? Sure. I don't want to be, of course, and we're going to give the sense of additional security for those of you that are having elective or semi-elective surgeries. We're going to test you ahead of time, and we're going to ask you to check your temperatures for 3 days before you come in, and we're going to check you for symptoms. We're going to make it as safe as we can for everybody involved. We've already got that system set up, and in emergency cases, or semi-emergent cases, or in cases that are an emergency transferred in from elsewhere, we have ability to do a more rapid test if we need it. But we're trying to save those because they're in short supply, and we know that we're going to need them for the foreseeable future, and we don't know when we're going to get more tests of that type. And so we're being judicious in how we use them, but they're there in case we need them. That's another level of security.
Any other questions?
Thank you very much.